George gauge is an adjustable instrument that can be preset to guide the mandible to the desired construction bite position. The gauge consists of three parts: the bite fork, the lower incisor clamp, and the body of the gauge. The lower incisor clamp slides in and out of the body and forms the lingual wall of the lower incisor notch. This notch can be adjusted to fit over rotated incisors. The bite fork, which also slides in and out of the body of the gauge, contains the perforated prongs that hold the registration material, the upper incisor notch, and the shaft whose anterior end indicates mandibular position on the millimeter scale of the body. Bite forks are available in two incisor notch sizes, one producing a 2 millimeter vertical incisal distance and the other 5 millimeters. The turn screws, which are located on the top and bottom of the body of the gauge, are used to stabilize the lower incisor clamp and the bite fork after their desired positions are located. When using the George gauge, it is important to make sure the incisor notches are firmly seated on these teeth. This is more often a problem with the mandibular teeth, which are usually more crowded and rotated than the maxillary. With the bite fork out of the gauge, center the lower incisor notch over these incisor teeth, either on the patient's models or in the mouth. In this case, you will notice that the notch does not seat on the incisal edges. Loosen the lower turn screw and again seat the notch over the incisors, allowing the incisor clamp to slide back, thereby enlarging the notch. Then, while firmly holding the incisor clamp against the lingual of the teeth, tighten the lower turn screw. Next, check the seating of the upper incisor notch. Most often, no adjustment will be necessary. However, occasionally rotated maxillary central incisors will prevent complete seating. When this is the case, take an acrylic burr and remove some of the plastic on the lingual of the notch. Do not remove from the labial of the notch, since the measurements are recorded from that point. After removing the plastic, make sure the incisors seat fully in the notch by trying it either on the models or in the patient's mouth. We will first demonstrate the use of the George gauge in the bite registration for the construction of a functional orthodontic appliance. This includes all the orthodontic appliances that correct malocclusions by posturing the mandible forward, such as activators, bionators, twin blocks, Frankel, Herbst, and all the variations of these appliances. After having adjusted the incisor clamp to the proper position, seat the lower incisor notch in the mouth. Observe the position of the right edge of the clamp when it is centered over the midline of the lower incisors. The lower midline will be obscured when the bite fork is in the gauge. Now insert the bite fork in the gauge and line up the marking end of the shaft of the bite fork with the 0 millimeter mark. When the bite fork is in this position, the gauge will guide the upper and lower incisors to an end-to-end position. Very lightly tighten the upper turn screw. Return the instrument to the mouth, seat the lower incisor notch while observing the right edge to make sure it is in the same position as it was in the previous trial. Hand the patient a mirror and ask her to close into the upper incisor notch with the midline indicator positioned between the central incisors. To make the midline indicator easier for the patient to see, mark it with an ordinary pencil. Now instruct the patient to slide the mandible back and forth a few times. Notice that as the mandible retrudes, the marking end of the bite fork travels toward the minus sign, and when the mandible protrudes, the marking end travels toward the plus sign. After the patient has moved her mandible back and forth a few times, tell her to move her jaw all the way back and hold it there. Observe and make a mental note of this position on the millimeter scale. Then tell the patient to move her jaw all the way forward and hold it there. Note this position also and record these positions and the protrusive range in the patient's chart. For example, if the patient could retrude to the -6 mark and could protrude to the +4, the patient has a protrusive range of 10 millimeters. In the patient's chart, you will have recorded retrusion -6 millimeters, protrusion +4 millimeters, protrusive range 10 millimeters. R for retrusion equals -6, P for protrusion equals +4, PR for protrusive range equals 10. Or simpler yet, -6 + 4, 10. Assume you want your appliance to hold the mandible in the most protrusive, unstrained position, and you assume that would be 70% of the protrusive range. You now have all the information you need to calculate the construction position. You may use this simple formula: PR for protrusive range times 70% plus R for retrusive position equals construction position. Substituting the values stated above, 10 for the protrusive range times 0.7 plus -6, which is the retrusive position, equals +1. That is the position at which you will set the gauge. Slide the shaft of the bite fork until the marking end aligns with the +1 mark on the millimeter scale and tighten the upper screw. The George gauge is now preset and ready to locate the mandible in the predetermined position. Have the patient practice closing into this position. Next, the prongs of the bite fork must be covered with registration material. The two most common materials used are base plate wax and silicone putty. The base plate wax sheet should be cut into quarters, that is 1½ times 3 inches. These strips can be heated over a flame or in hot water. The water should be heated to approximately 140 degrees. Wrap a warmed sheet around each prong of the bite fork. If necessary, the wax on the prongs may be reheated. Return the gauge with the impression material to the mouth with the lower incisor notch centered over the lower midline. Instruct the patient, who should be holding a mirror, to close into the upper incisor notch, taking care to align the upper incisors with the midline indicator. If there is a discrepancy between the upper and lower midlines when the patient closes into centric occlusion, determine whether the discrepancy is due to a dental or skeletal malpositioning. In most cases, functional appliances should not be used to correct midline deviations that are due to dental discrepancies. However, if the discrepancy is due to unsymmetrical mandibular growth, the midlines should be aligned in an attempt to give greater growth stimulus to the deficient mandibular condyle. If you would like to maintain a midline discrepancy, you can place the lower incisor notch off-center, then have the patient close into the upper midline. Or you can center the lower midline and make a mark on a maxillar incisor to guide the patient. My choice of registration material is silicone putty. I find it easier to use, and it provides a more accurate and durable record. The material comes in a canister such as this, from which you can scoop out a spoonful. Add hardener to the putty and knead it between the fingers until it reaches a homogeneous texture. Then roll it into a cigar shape and impale it on the prongs of the bite fork. The identical procedure is followed with the silicone as was done with the wax. However, inform the patient that if she notices that her midline is not lining up correctly with the indicator after her teeth have touched the silicone, she is to reopen slightly, shift the jaw, and close vertically into the correct position. She should not shift laterally through the registration material. After the registration is removed from the mouth, trim the excess material to about 1 millimeter from the occlusal surfaces. Remove the bite fork from the body of the gauge and send the construction bite on the bite fork along with the patient's models to the laboratory. For greater accuracy, or when working with poorly coordinated patients who have trouble closing directly into the registration material, set the gauge for the correct bite position, instruct the patient to close into the incisor notches, and use an injectable registration material between the teeth and the bite fork. If you are an experienced practitioner of functional orthodontic appliances, you will find that the George gauge, with its 2 vertical dimensions and infinite sagittal dimensions, can give you the optimum combination for almost any case. If you are a beginner in this phase of orthodontic therapy, you will find that the George gauge makes it easy to follow the instructions given in the dental literature or by a lecturing authority on the specific appliance you are using. However, bear in mind, now that there is an instrument that can accurately register and record the bite, clinical experience and research will be producing more data from which the optimum positions for various appliances can be determined. Also, the George gauge provides a more accurate method of communicating instructions, so many authorities will soon be giving more precise and explicit advice on bite registration.